Good evening, Bahamas. Coming up tonight.
TUC President Obi Ferguson says if a scheduled Monday meeting with the Prime Minister is just a courtesy call, that won't be enough.
The hotel union gets set for another round of negotiations with Atlantis officials.
Our news is brought to you by Alive.
Welcome to Our News and thanks for joining us. I'm Kyle Joaquin. Despite the Labor Minister's assertion that leaders of both umbrella unions have agreed to a meeting with Prime Minister Dr. Hippolyta on Monday morning, it turns out that meeting will be missing some key players. Trade Union Congress President Obi Ferguson says he, for one, won't be there. Jared Higgs reports.
Following a week that saw senior doctors withdraw their labor, Prime Minister Dr. Hubert Minnis announced through Minister of Labor Dion Folks that he'd be meeting with all unions on Monday at 10 a.m. Now, TUC President Obi Ferguson says he was never consulted about that meeting, and it doesn't make sense for more than a dozen unions to meet at one time.
If you're talking about a courtesy call meeting, that's a different situation. But it's impossible on Monday to meet and discuss the nurses' issues. That's an impossibility. Matter of fact, the president wouldn't be allowed to ask one question. Then you have the Consultant Physician Staff Association. They have issues. Then you have the junior doctors. They have issues. So what happened to Sandals? What happened to Martin Salt?
Not only did Ferguson say that such a large meeting wouldn't make sense, he says he wouldn't be able to attend as he was never consulted on his availability. He says a Court of Appeal appearance at 10 a.m. on Monday means he won't be at the office of the Prime Minister. Ferguson added that even if he could make Monday's meeting, it wouldn't make sense to fill OPM with dozens of union leaders all hoping to have their concerns addressed. The TUC president says he wrote a letter to Minnis urging him to meet with the three unions representing disgruntled healthcare professionals separately.
Let's meet today. We are willing to do that. We are willing to meet tomorrow. We are willing to meet on Sunday. But to meet on Monday to discuss, I mean, could you imagine? You got, what 30 unions in the Bahamas, right? Could you imagine? I'm not even talking about the offices, because each union has at least about 12 or 13 offices, executive offices. Could you imagine? Even if you put that group aside, and you just deal with the 30 unions, how, you explain to me, between the hours of 10 and 5, how could you address the issues affecting those unions?
The call for a meeting comes as senior doctors go into day 4 of their withdrawal of service. On Tuesday, CPSA officials announced that they would not be performing any elective procedures at public hospitals and clinics, leading the PHA to launch its Emergency Operations Center. CPSA Secretary Dr. Sabrika Pinder-Butler says the consultants continue to stand firm with the support of the Bahamas doctors and nurses unions.
We have not changed our position. We have done everything that we needed to do within the rules of the law. We want to return to continue to do our best to assist our patients and, all persons that need help in the Commonwealth of the Bahamas, and this is why we need to meet urgently with the Prime Minister. This can come to an end very quickly. We want it to come to an end. This is what we spent years of training to do. It's our job to attend to the sick and those that need care in the country, and we can't do our jobs. So we are still on industrial action, and once we get the word from the Prime Minister and meet with our team, then we will advise the public accordingly.
We are asking you, the PHA, to just follow the law. We are unable to strike, we are unable to withdraw services because our patients come first. Honor our moral standards, meet us there because we are restricted in what we do, and do the honorable thing and just follow the law and do what is fair and just. So you don't have to put our patients or the public in between us and use them as a pawn to deny what is right. That's all we're asking.
So you don't want the doctors to be out the hospital. You don't want the nurses to be out the hospital. You don't want the porters to be out the hospital. You don't want the auxiliary nurse to be out the hospital. And you sure know you don't want EMS not to be on the road. Then you don't want no hospital. You need to come to the table and work together for this country. That's what you need to do.
Ferguson also slammed Public Hospitals Authority officials who yesterday urged consultants to return to work, saying it was difficult to continue negotiations in good faith during the CPSA's industrial action. Ferguson says the bottom line is the doctors have a strike certificate.
All general remarks, we're not concerned about that. We're not. We have done everything legal. They can't tell the doctors that they didn't do it properly. How could they do that? And they all have a certificate.
Reporting for Our News, I'm Jared Higgs.
All right, thanks, Jared. Well, following a series of meetings and marches protesting a new shift system proposed by the PHA, members of the Bahamas Nurses Union eagerly await a strike vote scheduled for Tuesday. Union President Emmanuel Williams said preparations are underway.
We are now in the mode of going into a strike poll as of December the 4th from 9 to 5 at the various locations, PMH, SRC, which is Sandlands, and South Beach Department of Public Health, and the RAND, and all the family islands.
377 nurses voted to strike on June 7th. However, labor officials claim some nurses were not given the opportunity to vote. Williams is still taking issue with that outcome and claiming only 2 people were prevented from voting and no official complaint was made.
Why do you want to deny us the rights? And you've never had an official letter. The law says you must have an official letter from the complaint that they were denied the rights. No letter came in. We've never had a formal letter from labor saying that we're nil and void of a strike certificate. Up to the day, I've asked Mr. John Pinder, please send me that letter. There's no evidence. It's just playing the game.
The nurses union has cited that withheld strike certificate as one of the grounds in its application for a strike vote. The union remains at odds with the PHA over the new system that Williams says they never agreed to. She was asked if nurses would walk off the job if they get their strike certificate this time around.
We say again, we are willing to come to the table, but it's up to you to come there with a goodwill in working together for the best for the people. You don't come there with the same mentality of going nowhere and sticking. Negotiation is not about that. And we realize that we have a board that does not understand negotiation.
So we have that issue again, because it seems to be the
Well, if we have that issue again, we surely will be moving forward. Without a doubt, we will move forward. The nurses know the plan. We know the plan.
Meanwhile, President of the Bahamas Doctors Union, Dr. Melisande Bassett, told the press on Tuesday that the union recently applied for a strike vote. However, she revealed today that despite that application, they've agreed to hold off on industrial action as long as the consultant physicians are withdrawing their services.
Before the consultants took the decision to take a strike action, Dr. Monroe would have met with the junior doctors to let us know of his intention and to also discuss that collectively the 2 unions would never work in concert, would never have industrial action at the same time, will never have strike at the same time.
Junior doctors protested back in September, raising several issues, including a lack of maternity benefits and unpaid holidays. Bassett says the reason they won't strike alongside more than 100 senior physicians has to do with an oath to do no harm, and it would be on their conscience if a patient were to die because a doctor was not present.
That limits what they are able to do, what we are able to do in terms of showing full force of strike action. That's why the tactics that they are using had to be orchestrated, had to be planned, and only focused on non-emergency care and services that the hospital provides. And even outside of that, our consultants have still been available to us. We can call if we have emergencies or if we have concerns. They have still come out on emergency tasks, so they have not withdrawn care because our patients are our primary concern.
Well, the hotel union is in talks with Atlantis officials, and while they are optimistic that all will go well, union leaders are not ruling out further industrial action just yet. Jillian Gray has that.
As the hotel union gets set for a meeting with Atlantis officials on Monday, President Darren Woods says he's hoping that those negotiations go well. However, he said should they not, they have no problem taking it to the next step.
Our sincere hope is that we're able to resolve it, but if we are unable to, we stand ready, willing, and able to go to the next level. The only thing we need to do is meet with our membership and say to them, listen, we have done all that we could have done up to this point, and now we now place it into your hands. You decide the course of action that you want to take.
The Bahamas Hotel Catering and Allied Workers Union is at odds with Atlantis Paradise Island over a new shift system and 12-point penalty system. The hotel union threatened to take strike action and reveals that employees were on work to rule. Since then, Union President Darren Woods says union leaders met with Atlantis officials at the Department of Labor on Thursday.
I think it went well because we were able to talk, negotiate with management. Unlike in the past, they pretty much just said to us what it is that they wanted to do, as opposed to just negotiating with us. So we're optimistic that we will get a resolution. It's just the direction in which we go to get it. So we are prepared to continue talking, not for much longer.
Due to their troubled past with Atlantis officials, the hotel union president said they will not be speaking with management outside of the Department of Labor. The tourism minister has said the union's work to rule position was disheartening. Woods said there was no disruption in service. However, that could change if talks don't go well.
Despite what has happened, the tourism product has mushroomed, blossomed up to this point, right? Our people know how to work. Our people know how to serve the guests. It is only when we go to the next level when there will be cause for concern, if we have to go there.
In addition to Monday's meeting at the Department of Labor, Woods says he plans to attend a sit-down with the Prime Minister. Reporting for our News, I'm Jillian Gray.
Thanks, Jillian. Well, more than 6 months after the Office of the Spouse was announced, wife of the Prime Minister, Patricia Minnis, is insisting her work over the last few months has proven the naysayers wrong. She told reporters today that she has been hard at work addressing concerns of women and girls across the country. Jasmine Brown reports.
They were concerned that, I must get paid. They couldn't pay me. In that I'm not the hours that I put in, and plus I'm not looking for, that my fulfillment really is serving young women.
Mrs. Minnis was speaking on the sidelines of the ceremony to celebrate Women's Week at the National Training Agency this morning. She told our news team that she had been working hard over the last few months, focusing on the health and well-being of women and girls.
I have been working with, well, first of all, I have many women, especially, they would come into the office and they've been asking to volunteer. So I've had a lot of women coming to volunteer. And we have been working with the young girls especially. I spent October, which was Youth Month, I visited Abaco and I saw 4 schools in Abaco. I went to Long Island and Eleuthera.
In March, Foreign Affairs Minister Darren Henfield announced in Parliament that government would establish an Office of the Spouse under his ministry. Henfield revealed that the Prime Minister's wife would not be paid for the statutory position. Though she will not receive a paycheck, Henfield said the Prime Minister's spouse will be supported by the Ministry of Foreign Affairs as she engages with various regional and international bodies. Days after it was announced, Minnis told the press that the proposed budget for the Office of the Spouse of the Prime Minister was $10,000 annually, which she said would primarily be used for tea engagements. Today, Henfield confirmed the budget for the Office of the Spouse is $20,000. Meantime, there have been some who have openly criticized its establishment. The PM's wife says while there had been much debate on her new role, she believes she has proven the haters wrong.
I think most people didn't know of it, the first time when something is new. So there were those questions. But I've gotten feedback where people are now really engaged in what is happening.
Minnis says she will continue her mission to reduce gender-based violence, teen pregnancy, and non-communicable diseases, as well as eliminate cervical cancer and the mother-to-child transmission of HIV. Reporting for our News, I'm Jasmine Brown.
Still to come, the Prime Minister describes his relationship with one of 4 dissenting F&M MPs, plus how government is addressing gender pay gaps. Stay tuned.